Good evening. Here we are. This is Moshe Landman with the Green Party from Clarksburg, Maryland, bringing you a global perspective and a little pitbull to bring us in to this difficult topic on mental health. So that's why we needed this very fun kind of music. Keep your mind positive. But then again, parties can be dangerous if we go overboard, and that's when people get a little bit into drugs and alcohol. U.S. mental health and substance abuse addiction. This is the Green Party's view on the topic. To address America's mental health crisis, we will prioritize the expansion of mental health and rehabilitation services through the Substance Abuse and Mental Health Services Administration, SAMHSA, the agency within the U.S. Department of Health and Human Services that leads public health efforts to advance the behavioral health of the nation. This will be a national effort with state implementation. We must create a national dementia strategy to adequately fund research and support to treat the disease. Fully fund all mental health services via the new U.S. Universal Healthcare System. We spoke about that last video. And reduce wait times for mental health programs and treatments. Establish a new funding program to create a new peer-led LGBTQI2+ mental health programs and counseling. Ensure Indigenous peoples receive the health care they require without any bureaucratic delays, and create Indigenous-led healing programs using traditional knowledge systems. Isn't that interesting? They actually had their own sort of healing systems that include herbs, that include various kinds of alternative medicines, and we have a lot to learn from them. They use nature to heal. We're going to talk about that another time, but it also can include mental health through group settings. Fund more mental health services in rural and remote areas. Look into climate change related mental illnesses caused by natural disasters, extreme weather, displacement, etc., and fund ways to address both the diseases and their cause. Treat the opioid crisis as a healthcare issue rather than a criminal issue. And we have the big problem in Baltimore. Mobilize mental health organizations to prevent illness and suicide caused by anxieties surrounding social isolation, expensive housing, the climate crisis, the rise of white ethno-nationalism. I would add Donald Trump. Donald Trump is a mentally ill individual. His niece has a whole book, who is a psychologist. His own niece will tell you what's wrong with him. And he's created a whole movement of mentally ill Americans, from right-wing white nationalists and all the bad stuff in America. He's supported. So hopefully this is his last run. I don't know if he's going to win, but I don't think he's going to win for president. Biden will defeat him, but hopefully this is his last time. And finally, create a guaranteed livable income program to ensure that no one goes homeless while their mental illness is being treated. Everyone knows that many of the people that are homeless are mentally ill. We all seen them on the streets. It looks like there's something wrong. The reason why they can't get things going and have a regular job is their mind is not working properly. Many of them come back from war, so they're veterans. Others they've just lost it, and they just get into this cycle of the mind. A lot of times it's drugs, excessive drugs, whatever kind, marijuana, cocaine, heroin, other drugs, and they're on alcoholism, and then they just start living in the streets and start losing it. But a guaranteed livable income and a wage and a program to house these people. So it's all connected. Healthcare, income, the economy, having a job, having a place to live, and having a support system for mental health. But everyone's realizing now that mental health is critical. Now, on the next page of under the documents and setting, we have what's called the state of mental health in America. Listen to this, you'll be shocked. 21% of adults are experiencing a mental illness, equivalent to over 50 million Americans right now. So anytime you walk on the street, 1 out of 5 people has a mental illness. This is serious. Ready for this? 15% of adults had a substance use disorder in the past year. 93.5% did not receive treatment. So we have millions of Americans walking around with substance abuse issues, and they're not being treated. The percentage of adults reporting serious thoughts of suicide, 4.8%. Over 12 million people are thinking of suicide. 11% of adults who identified with 2 or more races reported serious thoughts of suicide is 11%. So minorities have a higher issue of thinking about suicide. 16% of youth reported suffering from at least one major depressive episode in the past year. More than 2.7 million youth are experiencing severe major depression. 55% of adults with a mental illness receive no treatment, over 28 million individuals. 11%, over 5.5 million adults with a mental illness are uninsured. 60% of youth with major depression do not receive mental health treatment. In the United States, there are 350 individuals for every one mental health provider. So we don't have enough mental health providers in the schools, in the colleges, in society. 28% of all adults with a mental illness reported that they were not able to receive the treatment they needed. Most reported they did not receive care because they could not afford it. So that goes back to the healthcare system. We have to cover, in this universal healthcare system, full mental health services, which can include many things. Psychology, in front of a psychologist, talk to them. You can have psychiatry with medication. You can have group counseling, Alcoholics Anonymous, people have drug issues, and just general groups like communities, which is very important for people in depression. 23% of adults who report experiencing 14 or more mentally unhealthy days each month were not able to see a doctor due to the costs. 1 in 10 youth with private insurance do not have coverage for mental or emotional difficulties. Over 1.2 million adults. And then we know that people are talking about the issues with trans people who are being targeted, and they're having more depression. Gay and lesbian and others, and minorities, and even religious minorities, and African Americans and Jews. They're attacking Jews now. So everybody is dealing with this. So what I can say is we have a crisis, the mental health crisis in America. The Green Party has a solution. We're going to cover everyone. We're going to have more of all these services we spoke about. We're going to integrate native systems, and maybe people can even visit these native tribal reservations and have sort of getaways there to learn about the healing. I know they have that in the famous Sequoia, the area in Arizona that's supposed to be a very spiritual area, the Red Rocks area there. But that's not exclusive. We have so many nice places people can go, and they can get peace of mind. I know in Tennessee there's now a big center for the yoga system in outside of Chattanooga by Sadhguru, which is, I recommend going there. There's going to be thousands of acres of place where really dedicated to your peace of mind and livable income. That's going to be huge. So these are all issues that the Green Party speaks about. It's going to be very key for us in the Green Party in our campaign. Thank you for watching. Have a great evening.